Welcome to this very special edition of the KAJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have DK Ciccone. She is a pain specialist, author, and certified Pilates instructor who helps people in pain improve strength, mobility, and well-being in a weight-neutral environment. Welcome to the show, DK.
Thank you. Thanks for having me.
You are welcome to the show, DK. You are welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll be talking about how one can conquer chronic pain and reclaim an active life. So, my first question is, DK, is to understand a bit, what is this pain all about? Is it that people, more than the pain, we perceive what pain is and then we consider it more, we feel much more pain about it? Help us understand from a common person's perspective the type of pain that you normally deal with.
Sure. So we think of pain as sort of being acute or chronic. So, like, if I fall down right now and I break my leg, that's a certain kind of pain that is very specifically tied to a physical event, right? It's very clear that once I heal my leg or whatever, the pain will most likely go away. That's what we would call like your structural or physical pain. But the pain we're talking about when it's chronic is pain that persists when the tissues have actually already healed. So that's actually a really broad range of folks. By most estimates, there are about 30% of the global adult population that is suffering from chronic pain at any given moment. And they believe that that is probably an underreported number because a lot of people, we get older and we're just kind of like, I'm in pain and that's just a normal part of my daily life, living experience. But actually being regularly uncomfortable in your body, having discomfort should not be a normal part of the human experience. So anytime we have pain that persists after the body has actually healed means that the pain is being triggered by any number of factors that are outside of your tissues. And so I'm working with folks who maybe had a surgery a long time or a replacement of a joint a while ago, or maybe they just have like an old high school injury that just keeps coming back with similar pain symptoms, or it's related to a chronic condition where the pain is coming back sort of systematically all over the body.
Right, right, DK. So I want to understand then this chronic pain, how they can, deal with it. What is the type of pain? Because pain, as you said, can be of several types because of several things. So what are the pains or different chronic situations in terms of pain that can be, you talk about movement, you talk about reclaiming your life. Tell us a bit about that so that, people can focus. Several times you are in pain, that you start understanding that, okay, the movement is not possible for me, but it is actually possible from your perspective if we
Yes.
understand. So tell us a bit about that sort of a thing so that a lot of people can reclaim that sort of a life for themselves.
Yeah, thank you. That's my hope anyway. I mean, I grew up with chronic pain. I had chronic pain from the time that I was 13 years old. And so this is not just something I talk about. This is something I lived in my body. And the reality is that your body evolutionarily, like, we did not evolve to sit around and be sedentary. Like, we actually do respond really well to movement. And so I guess there's two things. There's, first of all, the fact that movement is an imperative. Like, movement is something you have to do. If you don't maintain a certain repertoire of physical activities, you run the risk of becoming less independent in your older years. I mean, you want to be able to go and use the toilet by yourself without needing help. You want to be able to visit with your family and do all the things that are important. So in order to be able to keep doing those things, you have to move your body. And there's the fact that when you move your body, there are chemicals that are released in your brain that make you feel good. And so there's a really good chance that just moving the body will itself reduce your pain symptoms. I mean, obviously, it really depends on the reason why you're having the pain. But there's also just like a chemical aspect that I think we don't necessarily take account of, which is mental. In terms of our mental well-being, being physically active is actually a huge part of that. And so the story really, to break it down for me in terms of like what a person needs to do. I mean, first of all, you have to get a better understanding of why the pain is happening when it is. So I would say taking an inventory of what is going on in my life when I have pain symptoms that kick in. And that can be, we're not talking about the physical symptom or the physical situation that you're in. Like whether or not you sat for a long time is probably not the reason that your pain is kicking in, unless you have a specific condition that would make that the case. It has more likely to do with stress and, relationship issues and other things that are going on in our environments. And so we need to get really honest with ourselves and become better at understanding when our bodies are trying to tell us something, because pain ultimately is the brain's way of telling us that it perceives danger. That is why pain exists. Pain is fundamentally a good thing. If you were to step on a rusty nail and not feel pain, you'd probably die of an infection, right? So there's a reason why we've sustained pain as a function of our nervous system evolutionarily, because it saved our lives. So I think it's important to like recognize the function of pain, why it exists, and start to see it as a neutral sensation. Like I think we often feel a pain and then there's a panic that ensues, right? There's like a fear. We worry that it's permanent. We worry that it'll never go away. We worry that the movement that we were doing at the time it kicked in is something we'll never be able to do again. And most of that messaging is messaging even I heard with my pain growing up. And I realized that the idea that I had to stop moving because of my pain was not only incorrect, it was actually fundamentally hurting me. So being more active was better for me. And I think that most people can relate to that.
Right, DK. So tell us a bit about your understanding of pain, because you also have dealt it in your personal life, your own journey with chronic back pain. How did you see it then? How do you see it now? So that people, a lot of people who are perhaps at that stage in life when you were at yourself, in a young teen, then people can not lose hope and actually benefit themselves from your advice.
Yeah. So when it happened to me, I was 13 and I was an active dancer and I was very, had my heart set on being a professional performer. And, it's funny, writing the book and kind of going through the process of that story really made me also have a lot of empathy for my parents. So, like, if you're a parent with a child who suddenly is in pain, like, that must be really scary and confusing because there was nothing that happened. There was no car accident or any reason why I would suddenly have debilitating back pain. I mean, I basically spent 3 days on an ice pack on the floor in the living room because I couldn't move. I was in so much pain. And that just became a cycle that kept happening in my teens and in my 20s. It would come out of nowhere. And so the story that I told, that understanding I had of my pain at that time was I must have done something wrong, right? There was sort of a self-blaming. Also, B, there was that fear of permanence. Like, I'm never going to be able to dance again. I'm never going to be able to have joy again. Like, it's going to be like this forever. And then, C, I think, because I already had a negative message in my head about my body as a woman, as a dancer, where the world was telling me I needed to be smaller. I had to lose weight in order to be a dancer. I think it reinforced a really negative relationship between me and my body. And so I carried that with me for a really long time. And I went through all the physical therapies and the aqua therapies and the cortisone injections and the chiropractor. And I mean, I went through all those things over all the years. And it really wasn't until I started testing my hypotheses. Like, is it really true that I can't bend at the waist? And like, what would happen if I bent at the waist? And what would happen if I bent at the waist and then told myself not to be afraid of bending at the waist? And then little by little, I would incrementally increase the things that I could do, which built my confidence, which helped me do more things. And I also started to kind of repair my relationship with my body. I started to explore. And again, this doesn't happen overnight, right? And I certainly have days where I still am frustrated with my body. I think we all can experience that. but starting to be just really grateful for the fact that my body was showing up for me every day, and to be less adversarial with my physical vessel, and to try to be, again, just, channeling gratitude was a really important part of my journey, and also proving to myself that I was capable of things. And over time, I mean, I can now, bend over and deadlift 160 pounds. I mean, I never would have imagined that that was possible as a young person. And I think, when I work with people one-on-one, one of the first things we try to do is understand what are the aspects of movement that create fear for you. And we want to go after that. We want to unravel that. It's just a conditioned response. It's like your brain remembers that you made a movement, whatever it was, and it resulted in pain. And so it tells you not to do that movement again. It kind of like preemptively, it's trying to protect you. And so it's being efficient. So I think learning how to be also kind to ourselves. I don't know that we're very good at that, but also learning how to test ourselves safely to see, like, is the story that I'm telling myself about my physical capabilities, is it real? Because one, in the research, in scientific literature, people fear movement and then it causes them pain, and that is very well established. Also, people who are in chronic pain tend to underestimate what they're capable of, also in the scientific research. And I've just seen it in my studio working with people, that they will come in, they're in pain, and they will assume they can't do something. And so the minute that you start testing that and you build that confidence, it can really change the paradigm of how you look at your body and how you look at yourself in moving in the world.
Right, DK. So, how should we look at our relationship with our bodies, with vis-a-vis pain, that of a friend or as an adversary? Because
Yeah.
many a times you said we just tell. How do we know? Because doctors will also assess us several times the way we will tell our stories. Pain is a very different sort of a thing. They may find nothing wrong,
Yeah.
medically, but you will still continue to be in pain. If your mind tells you that, you tell yourself that, and the doctor will try to keep on investigating. He might even get confused, but you will be consuming more and more medicine or whatever it is. So, how should people look at, the pragmatic part? That yes, this is something that needs attention. This is something that is not. That can be very confusing. It is easy to say, but I want to understand some sort of a way one can better look at the pain that they have at different stages in life.
Yeah, that's a really good question. I mean, I think this is not to say that you shouldn't evaluate pain. I mean, definitely, if pain comes on, especially suddenly, I mean, go through the medical system, get a doctor's perspective. But I think once we've established that there isn't structurally anything going on in your body, then it's time to look elsewhere, because that means that the trigger for your pain is not happening in the tissue, it's happening somewhere else. So, I mean, always take the path that your doctor recommends, right? But like some of the things that I, ask people is sort of, does the pain migrate? Like one of the things that might happen is that one day it's in your shoulder, another day it's in your hip, another day it's in your foot. Then there's a really good chance that what we're talking about now is the kind of pain that is a result of stressors in the environment, and it is not related to your tissues at all, because pain just doesn't work that way. Like if your body was injured, it would stay there and it would be pretty consistent, right? It wouldn't like come and go and come and go. So again, the fact that it's like ebbing and flowing really inconsistently, the fact that it moves around your body, that is those are signs that you need to look elsewhere from the clinical environment for help. I mean, obviously there are nervous system conditions that, like multiple sclerosis and other things, even just functional neurological disorder, which is kind of general, that could mean that your nervous system itself, like the sensors themselves are off. And so the pain may not, may feel very tissue based, but it's like kind of connected to the nervous system. But one of the things I think people have as a misconception is arthritis. So we're all going to get arthritis, right? Like our bodies will age. And like, aren't we lucky that we live in an age where we're living so long that our tissues deteriorate while we're still in them? And I think what's interesting about arthritis is if I were to take 10 people off the street right now and stick them in a machine to get some imaging, the chances are 50% of them or more have degeneration in their spines, in their knees, in their hips, and they may feel nothing. So it is possible. I think one of the worst things that doctors do with arthritis is they say, oh my gosh, you're bone on bone, like you have no cartilage. And it sends a sort of alarmist message to people. And, that may be because they're surgeons. And so what they're seeing is a joint replacement is needed. But arthritis does not have to mean that you're in pain 24 hours a day. So I think that's just like one of the really common things, because arthritis is so common that we have to get out of our heads. Like we can continue to move. It's safe to move in general with arthritis. We want to build strength, right? We want to do things that increase resistance so we can have muscles that support our structures, so that the bones are not the only things supporting our structures. Like it's really, really, really important that we do something with resistance throughout all of the years of our lives so that we can maintain muscle tone in order to keep us really safe. And I think just paying attention to when the pain happens. I mean, waking up in the morning with a couple aches, it's pretty normal. And what I would say to that is, try a couple different movements that you can do in the morning that get you set up to feel ready for the day. I mean, even I have the same thing. I mean, I'm not like, my body feels better now than it did in my 20s, but I still wake up feeling achy and sometimes I can't put my socks on, without help. So I get down on the floor and I've learned what to do, but I think we don't give ourselves permission to explore that. I don't think we value the time that it requires to explore. What is the movement I can do that helps me get out of bed in the morning? And you'd be surprised when you explore. And of course, I help people with this all the time, so you can also contact me. But there's probably 3 to 5 things you can do every morning that will make a huge difference in the way that you feel when you try to enter your day.
And what are those things?
Well, it depends on the person, right? It depends on what their ache is. Let's say back pain, because that's so common, right? So if you wake up with a really stiff back, I want to see you do something that moves your back in all directions. So something that's a little bit that goes forward, we would call flexion, something that goes backward, which we call extension, and something that's rotation. So glute bridges are really great in the morning, kind of squeezing your hips up and just waking up the back of the body. Doing something that rounds you, maybe, rolling down to the ground if that's possible, or a cat-cow on all fours that helps you round your spine. Doing some side bending, right? And then doing some rotation. So I have a move I love called telescoping arms. You lie on your side and you put your hands forward, and then you kind of open your chest to the ceiling with your knees bent and then bring it back. And so this is a great twist and a good stretch. So I would say if you stuck to those 4 things, if you have back pain in the morning, that's a great way to get yourself started.
Absolutely. And perhaps this can be done with the phone in your hand if you are in the habit of waking up.
Absolutely.
Right, DK. So now I want to understand, in terms of you are a Pilates instructor, certified Pilates instructor, and where does that come into pain? Does that work in terms of chronic pain?
Well, so the reason I have found Pilates to be a really helpful vehicle as part of this pain journey is because it's one of the main principles is this balanced movement component. So a Pilates session, especially taught by someone like me who has a pain background, and there are many of us in the Pilates world who have a pain or therapeutic movement background, we will make sure you are flexing your body, extending, twisting, bending. You're doing all the things in all the directions. So that's just part of the Pilates exercise repertoire. The second part is we use resistance. So there's everything that you see behind me has springs on it, and the springs hum in varying tensions. So I can, for example, the reformer in the back that you could lie down on, you can do leg work with the springs on in a very non-impact way. So my knee replacement and hip replacement folks can very comfortably get down in that machine and use the resistance to build their muscles, maybe before they are able to say step up on a step, right? Or, they usually make you step up on a step before you leave the hospital, but a big step. So sometimes our body weight is even more than we can handle in a certain joint situation. So I can manipulate the springs to actually incrementally make a person stronger with the exercise until they can carry their body weight. I mean, that's always my goal, is to get you doing something, you know, that makes you excited. Pilates might not be the thing that makes you excited, but for me, that's the method to get you to, you know, skiing or, you know, hiking or whatever it is you would rather be doing. And I
Right.
also find that the springs, in addition to being resistance, the springs can help me add an unstable surface. So a big fear that triggers pain is a fear of falling, especially if you've had a fall in the past, or maybe you've been told you have a little bit of a bone density issue, and so you're afraid, right? So I can use the springs to test your balance, to improve balance. And our balance deteriorates starting at the age of 30. So like, we all need to work on our balance. And I live in a cold climate, so we have ice. So we need to work on our balance here too. So that's another reason why Pilates is really great, because almost everything that we work on, especially because I'm talking about the equipment, just like everything we work on has the ability to create that sense of instability, which helps your nervous system, your brain, and also your small muscles really support you and sustain you, so that in that moment when you trip, or in that moment where you feel you might fall, it kicks in, you know, as a muscle memory, and it protects you. So I think those are the things that make Pilates special. There's also a breath and a mobility component to it that was very healing for me in the time that I started taking Pilates after a disc herniation. I found it really restorative in my body. So, I mean, again, but it doesn't have to be Pilates. I would say move in a way that makes you happy, brings you joy, and it'll still be valuable.
Right. Tell us a bit about your book. You are
Yeah.
meant to move. Tell us so that people can make use of that book and learn a lot beyond this episode.
Yeah, that would be great. I hope that they do. So the book is available on Amazon globally. So it's called You're Meant to Move. It's written as a 14-week program. So what I wanted, I mean, I can't fit the whole world inside my studio. And so I wanted the ability to help people who couldn't work with me kind of go through the journey that I take people through when they work with me. And so it tells my story. It has all my personal story kind of written through it. It also has the stories of my various clients I've worked with who've gotten over complex regional pain syndrome, who have been conquering multiple sclerosis and just many other issues, and finding joy in movement again. And so each week you have exercises, a journaling prompt usually, and some kind of movement that you would be expected to do. And by the end of the 14-week program, there's a template available where you can make your own personalized movement program that is oriented around your individual goals, right? Because everyone's goals are different. And so that is the goal of the book. And I hope that folks read it, and also let me know what they think, because if there's other resources that would be helpful. Basically, I just want the world to recognize that suffering silently with chronic pain, it's common, but it's not normal. It's like our silent epidemic. There really are just so many people out there who are uncomfortable in their bodies, and they don't have to be.
Absolutely, absolutely. There's much to learn from you, understand from you about chronic pain. So, for those people who would want to connect with you, what is the best way to do so?
Yeah. So you can reach me at dk@movementremedies.org. Movementremedies.org is my website. And I'm also on Instagram. That's my most common social media platform, at movement_remedies.
Wonderful. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for
My
joining
pleasure.
us.
It was my honor. Thank you.